Hey, listen, I don't have to tell you that Medicare can be confusing, especially when it comes to how you want to be covered by Medicare. And there are essentially two choices, which are Medicare Supplement or Medicare Advantage plans. And they are entirely different. And not one is better than the other. It really comes down to your personal preference. So in this video, I will break down the differences between these two plans so you can have a better understanding of what's right for you. Lightning strikes and then you're gonna know my name. All right, before we get into the differences of a Medicare Supplement and a Medicare Advantage plan, it is important that we start with original Medicare and briefly talk about that first. So, the two parts of Medicare that I want to talk about right now is Part A and Part B. Part A of Medicare helps cover inpatient care in a hospital, skilled nursing facility care, hospice care, and some home health care. And so, for the vast majority of people, there is no cost for Part A, and you become automatically enrolled at age 65 or younger if you are on Medicare disability. Now, if you go to a hospital and are only covered by Medicare, you will pay a deductible, which in 2024 is $1,632. Now, this deductible could change from year to year. Now, after that deductible, you pay no costs in the first 60 days. Now, in days 61 through 90, you would pay $408 per day, after which you would then pay $816 per day up to 60 days in a lifetime. If you stay in a skilled nursing home, for the first 60 days, you pay $0. Days 21 through 100, you would pay $204 per day, and after that, you would pay for the full cost. Now, it is important to note that these deductibles and co-payments, they may change from year to year. Now, the next part of Medicare that I want to go over is Medicare Part B. Part B helps cover doctor visits and services as well as outpatient care. Now, Part D does have a cost that comes with it, which is $174.70. Now, that's in 2024. That premium could be higher depending on your income. And if you are only covered by Medicare, you will have an annual deductible of $240. Now, this could change from year to year as well. Now, after the deductible, Medicare would pay 80% of the cost associated for medical expenses, and you would pay 20% of the costs. So, what about prescription drugs? Prescription drugs are not covered by original Medicare, and you would need to either get a standalone prescription drug plan or through a Medicare Advantage plan. Now, more on that later. Okay, now that's original Medicare. As you can see, there will be out-of-pocket expenses on your part if you are only covered by Medicare. That's where you can choose to have a Medicare Supplement or a Medicare Advantage to help with those costs. So what's the difference? How do you choose? Well, before we get into that, you may want to go ahead and subscribe to this channel, give this video a thumbs up. I post a lot of content about Medicare and retirement that you might enjoy. Okay, let's talk about the Medicare Supplement. Medicare Supplements are offered by private insurance companies. It works in conjunction with original Medicare, and you would still pay that Part B premium along with whatever the premium is for the Medicare Supplement. Now, currently there are 10 standardized plans you can choose from, and I'm going to put that on the screen. It'll have a breakdown of those plans. So as of now, in my opinion, Plan G is very popular. It pays the Part A deductible and the co-insurance in the hospital, and it pays the 20% for Part B expenses. Medicare pays the rest. So the only thing you would pay is the Part B deductible of $240, and that's in a year's time. So with a Medicare Supplement, there are no networks, no list of doctors or hospitals you must go to. You can see any doctor, you can go to any hospital, and for the most part, there is no prior authorization. You essentially pay your monthly premium and your Part B deductible That's it. So that sounds good, but here are some things to consider with a Medicare supplement. Premiums can be high, and they're going to increase every year, and there is no prescription drug coverage, and you will have to purchase a standalone prescription drug plan. It only covers what Medicare would cover, so there are no extra benefits like dental or vision wear, hearing aids, or gym benefits. And there would be medical underwriting, meaning if you have certain health conditions, you may not be able to qualify for a Medicare supplement unless you are new to Medicare within the first 6 months. And the plan benefits, they do not change each year. It stays the same, and you can change your Medicare supplement plan whenever you want. Now, let's talk about the Medicare Advantage Plan. Medicare Advantage plans are also offered by private insurance companies, but the premiums are very little, and a lot of plans have a zero plan premium, so the cost going in virtually nothing. Now, you, however, would still pay the Part B premium of Medicare, so it works a little differently. You pay either zero or very little premium, but when you go to a doctor, hospital, or other costs, you would pay a copay or a coinsurance. So it's kind of like it's a pay-as-you-go type of plan. However, there are annual maximum out-of-pocket costs for those copays, and they vary from plan to plan. Usually it's a few $1,000s for the year for that maximum out-of-pocket cost. There are networks with Medicare Advantage plans. You must see the doctors or the hospitals within that network. However, if that Medicare Advantage plan is a PPO, they will cover you whether it is in network or out of network. You would just pay a higher copay rate if it's out of network. Now, with most Medicare Advantage plans, prescription drugs, they're built in, so there is no need to purchase a standalone prescription drug plan. Unlike Medicare supplements, there are only certain times of the year you can change your plan. Now, to make it easier to compare these two types of plans, let's put them side by side and look at various features and how they would be covered. So in this chart, we're going to lay out the differences, the features between supplement and advantage. First of all, premiums. With a Medicare supplement, they are higher premiums. They're going to increase each year, and as you get older or have it for a long time, it could be several $1,000s a year over time. With a Medicare Advantage, it's either very low premium or a lot of them will have a zero plan premium. Next, what about the ability to choose your own doctor or hospital? With Medicare Supplement, yes, you go to any doctor, any hospital you want, as long as they accept a Medicare patient. Medicare Advantage, they will have networks that a list of doctors or hospitals that you need to stay within that list, but if it's a PPO, it will still cover you out of network. Next, let's look at out-of-pocket costs. So with the Medicare Supplement, especially the G plan, you basically have a deductible, $240 a year, and that's pretty much it. Obviously, you pay the premiums. With the Medicare Advantage, there are going to be copays, there's going to be co-insurance, but it is up to a maximum amount out-of-pocket limit for the year. Let's look at prescription drugs. Well, with the Medicare Supplement, they do not cover prescription drugs. You got to take a standalone PDP plan, prescription drug plan, and that's at additional cost. Medicare Advantage plans, however, most of those plans include prescription drugs with no additional premium. Next, let's look at medical underwriting. With a Medicare Supplement, yes, you must qualify health-wise. They'll have a list of questions like, have you had a heart attack in the last 2 years, diabetes, or so forth? And some of them you will not be able to qualify if you have a health condition unless you're new to Medicare. You have a 6-month window with no questions asked. With the Medicare Advantage plan, no medical underwriting, very easy to qualify. Next, let's look at how benefit changes each year. With a Medicare Supplement, the benefits do not change from year to year. They're just going to cover what Medicare doesn't. With a Medicare Advantage, yep, you're going to expect those benefits to change each year. Sometimes they will increase the benefits, sometimes they will increase the benefits. Next, let's look at extra benefits like dental or vision, hearing aids, fitness memberships. Does a Medicare supplement cover those? No, none of those extra benefits are covered. However, with a Medicare Advantage, yes, many plans offer dental, vision, hearing, etc. Next, let's look at prior authorization. Do you have to get something approved like a surgery before they're going to pay? With a Medicare supplement, generally no. There is no prior authorization. With a Medicare Advantage, however, they may require prior authorization for certain services. So now, which one is better? Well, that's like, Ford and Chevrolet. Some people like Fords. Some people like Chevrolet. Some people like the Medicare supplements because they don't care about the higher premiums and it's going up all the time. They don't care about extra benefits like dental or vision. They don't care about having to purchase a standalone prescription drug plan. They would rather pay those premiums and not fool around with networks and co-pays. Others like Medicare Advantage plans because of the zero or very little premium, and they just want to pay the co-pays as they go along. They like the idea of having those extra benefits and having drug coverage built in. Now, since it depends on your particular situation, I would recommend getting with a professional that is knowledgeable about these plans before making a decision. And if we need to talk, check out the resources below. If you like what you're seeing so far, check out this next video. Subscribe to the channel. Lord willing, we'll see you next time.